Huw Irranca-Davies.
Diolch, Dr Medlicott. Minister, can I commend Dr Sarah Medlicott of Morgannwg Surgery and other GPs who contacted me over a week ago, expressing their desire to begin vaccinations of a relatively small group of frontline police medics who are at higher risk of exposure to the virus in a very specialised line of work. But as you know, Minister, we had a frustrating problem immediately in that the JCVI did not at that point last week include police medics in their top priorities. So Minister, can I thank you and your officials and your advisors for the work you've done to advocate for the inclusion of police medics in the priority 2 group, which of course includes frontline health and social care workers. Could I ask you, Minister, for an update on this so that Dr Medlicott and fellow GPs can get on now with vaccinating police medics across the Bridgend and the Morgannwg Health Board area, but also so that all health boards in Wales ensure that police medics are now recognised as frontline healthcare workers and can be rapidly vaccinated as part of Priority Group 2. And finally, Minister, can I just say well done to Team Wales and NHS Wales, including medical staff and volunteers, for the success with the vaccine rollout. It's been one heck of an effort, and I've seen it firsthand. I commend them all.
Minister.
Thank you. I'll deal with both points. In terms of Dr Medlicott and the work the local GPs have done around police medics, you're very current because today I've agreed, and there's a note gone out through our system, that police medics are to be considered as analogous to Group 2 because of the direct patient contact work they have. And it's analogous to a range of other activities. So that does make sense. And there's some understanding the JCVI advice. It doesn't always allow us to understand every single nuanced area of practice. And that's why we've had to review some of these as we have gone on. The same points about the intimate care provision that some members of staff in education provide for special education needs children in particular. So that should be a consistent picture across Wales, and that's gone out into the system today. And thank you to Dr Medlicott and her colleagues for highlighting the issue, which has allowed us, including the questions you've asked, to make sure that issue is resolved. In terms of Team Wales, I think it's a tremendous Team Wales effort. And as I've said repeatedly, at the start of this, I said that we would end up in a position not dissimilar to other UK nations, and we wouldn't be left behind. After an initial modestly slower start, we've now caught up and surpassed other UK nations. We need to maintain the pace, though, not just for the next couple of weeks, but for many, many months ahead. That's why in many ways, I said it was a marathon in my statement, but in many ways it's an ultra marathon. One marathon after another, and still needing to maintain the same relentless pace to make sure we have different choices to make in the future. And I certainly look forward to being able to do so.